got a friend in me. Senator Bernie Sanders has rekindled his ideological bromance with podcaster Joe Rogan.
Here's Rogan on a recent episode with podcaster Chris Williamson.
Where are you at with healthcare?
I think healthcare 100% should be socially funded. I think that Medicare and Medicaid, having programs where people who are hurt can get an operation and it's not going to bankrupt them for the rest of their life, is another thing that I think society should be. It should be a part of our agreement to take care of each other as a community, that we chip in money for what people would think of as socialist positions. And I always bring up the fire department because the fire department is one of the best examples that everybody sort of agrees. It's a socialist sort of thing.
In response to the Rogan clip, Sanders wrote on X, Joe Rogan is absolutely right about this.
In 2020, Joe Rogan had endorsed Bernie Sanders before Biden became the nominee.
Who are you going to vote for in the primary?
I think I'll probably vote for Bernie.
Interesting.
Yeah. Because I think Bernie and Tulsi together would be a fucking devastating combination. I really do. I don't know if they'd ever work out together. I don't know if that's possible. But I think them together might work.
A Joe Rogan segment that I can celebrate, Robby. Mr. Rogan on the right side of a big issue.
Yeah.
Universal health care and its moral and political import and value.
Well, I don't want to burst your bubble entirely because I enjoy your happiness is pleasing to me, but I don't know that he was quite. Look, he was putting it in the most the least controversial means possible, saying yes, most people agree that I guess even heartless libertarian Robby that there can be some social provision for people who are not well off, that there will be some kind of welfare and protection and as a society providing for people in their time of need. That's, yes, pretty non-controversial. Now, whether that takes the form of a massive government-run health insurance or help providing thing or what form it takes is then up for discussing the policy details, but yes, most people think that if you get in like a catastrophic car accident on the street, and that they want you to be taken care of even if you don't have the money for. Now, that's why you pay into an insurance system, right? And the whole Obamacare fight is whether you have to be forced. Can the government compel you to have health insurance if you don't want to have health insurance for whatever reason? And I would have said morally and philosophically, no, the government can't make you buy something you don't want to buy, but the Supreme Court said that they can, legally that they can. It's a form of taxation, so here we are. I don't really, again, object to government providing some measure of protection for people who are not well off. I had a lot of arguments with Marianne Williamson, who has been in this chair a couple days last week and the week before, and she ends up radicalizing me more against this system than I was before because of the tremendous provision that must be taken for older Americans in terms of their increased and advanced and extreme medical costs. And I keep making the point that, I mean, if your standpoint is the government is going to provide for people's medical expenses in all cases, no matter what, well, then we'll end up having to ration medical care because there's just a finite amount of medical care that we can provide because there's a finite number of doctors, finite number of hospitals, finite number of beds in hospitals. So then you do end up with some kind of government commission that says, okay, yeah, you can't, we will pay for that, we will, or this is the order in which people get it, and then you get a kind of Canadian system where people wait, they complain about waiting too long. Yes, it's all paid for, but you wait forever, even for, we hear anecdotally, and it's more than anecdotal, but people waiting in extremely long lines for very basic tests and checkups and things of that nature.
So I think the rationing argument is frankly a bit of a red herring, but I want to get on to the bigger point. But on the rationing argument, right now, millions and millions of Americans have to deal with insurance companies making those decisions for them. We will pay for this treatment, but not that treatment. We will pay for you to see that specialist, but not this specialist. So that is rationing of a kind with from
Well, the current system
with a profit margin.
is horrible. It's
Right.
absolutely horrific.
Now, the bigger...
It's a mixed government-private thing that doesn't work at all.
Right. So the bigger point that I would make, and here's where myself and Joe Rogan are on the same page, which doesn't happen all that often. It has been an argument that has been widely accepted almost everywhere else in the world, that when someone falls ill or has a grave health crisis, it is to the greater good of society to have that dealt with, where you disseminate the costs for that across the whole society by general taxation, and when people fall sick, they do not have to be concerned about their ability to pay. That was accepted in the United Kingdom in 1947, a guy called Aaron Bevan, the father of the modern National Health Service in Britain. It is accepted in every other developed nation. And in the United States, people say, oh no, we can't have that infringement on our freedom. It is a right for people to not have to worry about being placed into bankruptcy by a health crisis.
The fact that it's done in every other whatever developed nation doesn't move me in the least bit, because other nations do all sorts of things I don't approve of. The argument that does move me is that we spend even more than they do, and we get, by some measures, less desirable outcomes. Look, I would just say, I want to try to introduce more market mechanisms and more competition to bring down the prices of these services. That generally works in other sectors of the economy. Can we introduce, I'm not saying we're going to go some totally private system where if you can't pay for it, you don't get anything, but can we introduce market mechanisms that in every other consumer electronics, housing, food, everything, having competition tends to bring down prices. The problem, and I'm sure we don't really disagree with this, the problem is, yes, the health insurance plans are terrible. It's Byzantine, even trying to comprehend what is covered. But because often insurance works this way, that because the actual price of the thing is disguised by insurance paying for it, there's no incentive to keep down the cost, because the costs end up so diffused against the entire population. And so you have medical services, you don't even know what it costs. The insurance company's being billed for it, and then they distribute the cost among everyone in a way that I would argue is bad, that allows for the disguising of the price of it under this hybrid system we have that no one, including myself, likes very much.
But the problem is, your view, which is, I think, a standard libertarian view of almost everything, is the market will take care of it. But the market
will drive down, not the market will take care of it, the market will drive down prices for the thing.
Well, right now you have CEOs of health insurance companies on vast salaries, and those are salaries that are ultimately being paid by you and I and employers who pay those premiums. Now, there is no actual need for the middleman in these circumstances getting these enormous amounts of money that is just wasted money that is splurged around, and is one of the reasons why prices for health services, for health treatment, gets buoyed up to such a ludicrous extent.
Yes, I mean, I would then be for saying these insurance options are bad. You should not have to buy one, but you are mandated by law to pick one, and and that makes them worse. If they had to actually compete for you to invest in the project of having this health insurance, that would, some would argue, maybe you say that's not true, but would make it better as they compete for you to actually be enrolled in their plan.
I mean, there's a much simpler way of doing it, which is to say healthcare will be paid out of general taxation, and it will be a national health service.
Don't you have to set the price of it then? What if doctors say, okay, an hour of my time costs $80 million, and now that's just being spread across the thing?
Well, then the government says no, and you come to terms.
Right. So then you agree. You must have government setting the price of all these in order for this system to work, right?
Yes.
The government has to set the price of all these things.
Right, yeah.
Okay, but they have no expertise or knowledge for how many things these should cost because they have no market competition.
But that's like
say,
any
how
kind
does
of
it? No, it's not like anything else, because in anything else you have say, here's how much I'm charging for an apple, here's how much I'm charging for an apple, and you have the market bring down the price. If the government gets to determine that they could determine it so high that that's how you get shortages and rationing in, Soviet-run type systems, right? Because they don't know what the price.
It's not in their interest to do that, though. It's not in anyone's interest
They don't
to
possess
seize up
the
the
knowledge of. They don't have. The price signal can only function if there's a market in the thing. The government doesn't know what the thing costs intrinsically because it only costs something with respect to what you're willing to pay for it. I mean, this is like the socialist economic calculation debate that we're having here for fun.
All those terrible socialists giving people health care. What can be done about it?
Oh, that does it for us today on Rising. I didn't expect a really saucy battle over a Joe Rogan clip, but here we are. Please be sure to like, share, and subscribe so you never miss any content. And for those of you who like to listen while on the go, we're now available anywhere you can listen to podcasts. Tell us what you thought about this debate. I'd be interested to hear it. And I'll be back tomorrow with more Rising. See you then.